Welcome to Sectors Up Close. I'm Elena Casas. Today we're talking healthcare with Matt Miskin, Co-Chief Investment Strategist at John Hancock Investment Management. Healthcare stocks didn't go into 2025 fighting fit. The S&P 500 health sector gained just 11.9% in 2024, compared with 23% for the market as a whole. The big news story there has, of course, been obesity drugs like Ozempic, where US manufacturers like Eli Lilly are scrambling to catch up with Denmark's Novo Nordisk. But should investors try being overweight healthcare in 2025? Let's ask Matt Miskin of John Hancock. Matt, you singled this sector out as a growth prospect. Why?
So into 2025, it actually has the second highest earnings estimates across all sectors. So other than technology, it's number 2 at 20% earnings growth. It's already trading at a cheap valuation. We think it's got strong fundamentals and relatively great valuations starting in 2025.
What's driving that earnings growth then?
It's really a comeback story. So healthcare has had a tougher period since COVID. Where they had really strong earnings growth. They had declined, but now they're coming back. And we're seeing innovation there. We're seeing new drugs in the pipeline. We're also seeing equipment and services. And then even on the insurance side, they are raising insurance rates with inflation. It is a bit of an inflation protection part of the market because they can raise prices. So broadly speaking, fundamentals look really positive.
You mentioned drug makers there. The big headline, of course, has been obesity drugs over the last year or two. Are competitors to Novo Nordisk starting to catch up ground in that space, or is there only one game in town?
There are a lot of competitors, and really we see actually healthcare as a global play. Europe actually has a lot of great healthcare companies. It's of the best sectors fundamentally there, and the United States has it too. But more broadly speaking, what we're seeing is there's innovation in healthcare that's not AI. The market is so tied to AI. Everywhere you look across the markets, whether it's even utilities or technology, is AI related, whereas healthcare is different. So that's something we think is actually very positive for it. It still gives you the earnings growth, but it doesn't have that AI. Either it's going to be great or it's going to be negative type market response.
What key areas of drug research do you think investors should be reading up on then if they're trying to find the next Ozempic? What looks like it might be exciting?
You know, there's always a new one in the pipeline, and we want to just think about elective procedures and surgeries and, or pharmaceutical drugs that can help. There are things secularly, obviously, with aging demographics that are going to be beneficial, but this has all been overlooked the last couple of years. The innovation side, it's been concentrated in that weight loss drug. There is a lot of other options. For hospitals, there's a lot more elective surgeries, like I said, and there's medical devices there. We just are looking for highly profitable companies in general. And for us, you want to move away from the lower market cap, more biotech to more established type of pharmaceutical companies that also have a growth kicker. But there's actually a lot of those in the top of the index. So just looking at broad-based healthcare, there's a lot of good earnings potential.
How much might policy change under the new US administration make a difference here?
It certainly could, but a couple things we've seen as it relates to politics in the healthcare sector or just the markets in general. First, a lot of the market pricing usually happens by inauguration. So the president gets elected through inauguration period. The markets go through a lot of changes. That usually is the biggest repricing we see. So we're already past that period, and healthcare was no exception. It certainly repriced on that. The other thing is that oddly enough, historically speaking, the first year under a Republican administration has usually been good for healthcare. More times than not, healthcare has actually outperformed the S&P 500 in periods where a Republican administration has come into office. So it's a bit counterintuitive, but a lot of times what we see is weakness before the election or right after the election as it gets priced in, and then after inauguration, it reprices and there's value unlocked. That's part of the story we actually like here for the healthcare sector into 2025.
Matt, do you think obesity drugs might be so successful that investors should be avoiding unhealthy stocks like fast food or alcohol companies? Are they going to suffer here?
It's possible, I think that's a bit of a leap to say, that you're going to reduce your kind of intake on that. It might actually just be a counterbalance. So you keep that up, but they're using this as a way to minimize the impact of it. But, consumer staple companies have been under pressure more broadly. It's one of the worst performing sectors. And that's what we're looking for, though, more broadly, is defensive sectors, things that people want or need, or, are kind of more staple type businesses, but with some growth and some cheapness to them. And Staples doesn't really meet all those criteria, but healthcare does.
Matt Miskin of John Hancock Investment Management, thank you so much. Well, that's our look at US healthcare. You can watch more videos on Reuters.com.